actually vote on something, I will make sure that it's paid for, unlike the mistakes that were made in the prior Congresses in relation to health care. That's my promise to you. That's paid for, that we don't continue to rack up our debt deficit. But, and that speaks to a lot of it. Again, I can't, every bill has a different approach to it, but that's something that we're discussing right now. So thank you for your questions. You brought up some great points.
Good evening, Gary Italiano, Sierra Vista. Thank you for coming. And I think we all agree we need some health reform. I only have two questions real quick. Would you vote for H.R. 32 or any health care bill that does not have some kind of tort reform in it?
Well, I won't vote for H.R. 3200 as it currently exists. And I don't think that H.R. 3200 will actually come to the floor because of all the problems that we hear about. There's a sliver, there's a mention of tort reform in there that deals with the states, because as we all know, most of the tort reform that we have in this day and age comes from state legislatures, and I talked about having voted for tort reform. But I'm not going to make a promise that I'm not going to be able to keep. And again, I'm going to fight for it, just like I'm fighting to make sure that it's paid for, and it's critical. You have my commitment on that.
The gentleman stood up here before about his wife that had problems. A lot of the problems she has because a lot of the doctors are charging so much to pay for the insurances. People are paying for so much for insurance. If it was down, we could afford to pay for stuff like that. The other last question is, would you have any health care bill that didn't allow insurance companies to cross state lines?
This is an interesting issue. Currently, our health insurance companies are regulated by our state commissioners. Former Governor Napolitano had a state commissioner who was just replaced about 2 weeks ago by another state commissioner under our new governor, Governor Brewer. And, you know, I'm kind of a local control gal. I kind of believe that we want to have, we don't necessarily want to have the same type rules that maybe California has, maybe New York has, when it comes to some of these. We're pretty moderate. In a lot of areas, Arizona is pretty conservative. So I'm less concerned about the party, the ability to do business across state lines. I'm going to fight for the people that elect me, which is all of you. It's not the insurance companies, it's not Nancy Pelosi, it's not the leadership. You all submit to Congress. And that's what I feel that local control is a little bit closer to the American people.
My name is Leah Barnes. I'm a resident of Sierra Vista. More of a comment than a question. Industry. We all thank. We don't need government takeover in all of our lives. They have government control. They have never known anything different. It's been there since the late 40s, early 50s. I would rather have choices made by me, not by the government. Because they're young, they're healthy, they don't need it. I lived on prayer with my 3 sons in California when they were little. I had no insurance. That, to me, came later in life, and thankfully I don't need it. And that's the way I've been lucky. So keep in mind that we need to clean up Medicare and Medicaid, help those that are uninsured, not the whole world. U.S. Thank you.
You brought up something that I hear over and over and over again about concern because so much is happening so quickly. And the gentleman talked earlier about slowing down and having a chance to really understand what's going on. One aspect that hasn't been addressed tonight, but I want to bring it out because I see some folks in the audience that put a lot of pressure on me for not supporting the single-payer program, which is the Canada-style health insurance program. And I've got a lot of that are not happy with me for not supporting the single-payer program. And again, this is not a backdoor single-payer. If we wanted to go single-payer, why not go now? The approach of what this reform is trying to do is to give folks more options. And And the whole idea of the public option is, for example, if and I don't know whether or not you're on Medicare. Okay, there's folks that have their options who maybe the VA, maybe Medicaid, their private employer offers some care. There's sort of these pools of abilities to go in and get health insurance. Well, a public option would be another pool for individuals to buy into a larger risk pool. And let me talk a little bit, and I know that I just want to touch base. I'm a former small business owner, and I think we have some small business owners out here as well. Now, about 20% of all businesses in America are businesses with fewer than 20 people. And only about 50% of those companies can afford to pay for health insurance for their employees, even if it's just one employee. 99% of businesses with over 200 employees provide coverage. So what I like about this approach is that if you're a small business owner, you're able to compete and you're able to join with millions of other folks in buying into a competitive program where companies are bidding and competing, which I think is truly a great free market way to drive down the cost.